It's okay, we can change it. We'll change it in.
Good morning and welcome to the University of Adelaide graduation ceremony. This morning's ceremony is for graduates from the Faculty of Health and Medical Sciences. The ceremony will commence very shortly. The university has a contract photographer to provide photography services during the ceremony. If you wish to take photos, I will ask that you do so discreetly from your seat and please do not use flash. To maintain the ceremony's sense of occasion, please switch off your mobile phones. In the case of an emergency, please follow the discretion of staff members. The emergency assembly point is the Goodman Crescent Lawns to the western side of Benithan Hall, and the evacuation plan can be found on page 9 of the program. For safety reasons, guests are not to enter the galleries upstairs, and please do not sit on the steps in the balcony area. Before we begin, I kindly ask you to direct your attention to the detailed order of proceedings which will guide us through today's ceremony. Accompanying this, you will find the graduation ceremony booklet, which serves as a cherished memento of this day. Thank you and enjoy the ceremony.
Give me like tilt down, zoom in, zoom out, and like this basically. Rolling on all cameras. Got a red dot. Mine's on the screen. Got my thumb. Wait.
The academic procession is about to enter the hall. We will be singing the national anthem. The words are on page 8 of the program. Please now stand if you are comfortably able to do so for the academic procession and remain standing for the national anthem.
I, Catherine Branson, Chancellor of the University of Adelaide, declare open this congregation, convened for the purpose of presenting degrees. Distinguished guests, parents, friends, especially graduates, welcome to the University of Adelaide's graduation ceremony. Gana Miana, Gana Yata, Nadlu Thampandi. We recognise that we're on Gana land. We acknowledge the Gana people, past and present, the original custodians of the Adelaide Plains, and thus of the land on which the University of Adelaide's campuses are built. We acknowledge the Gana people's important contribution to the long history of this state and their ongoing spiritual connection to the land. Graduates, your graduation is an event in which I hope you take great pride. Your family, I know, take great pride in your success, and the university does also. Graduation Day is a day for you to reflect, perhaps on what brought you to this day and on what your future holds. I congratulate you on having selected to study for qualifications that will enable you to contribute very greatly to your community, wherever that community may be. I feel confident that the skills you've learned here, the knowledge we'll gain, will stand you in very good stead as you serve the people who will come your way as graduates, and also, I hope, in your private life as well. Congratulations on your achievements today. I now call on the Vice-Chancellor and President, Professor Peter Hoy, to present the candidate for an honorary degree.
Chancellor, it gives me great pleasure to present to you an outstanding candidate for admission to the honorary degree of Doctor of the University, honoris causa, Professor John James McNeill, AO. Professor McNeill's contributions to medical research have changed the way we think about chronic disease, preventative health, and health care quality. He has forged an illustrious career since graduating from the University of Adelaide with an MBBS in 1971. Receiving a Distinguished Alumni Award from the university 51 years later, in 2022, he said, "It means a lot to me because I greatly enjoyed being an undergraduate at the University of Adelaide. In addition, my experience working in University of Adelaide's Department of Physiology and Pharmacology as a Heart Foundation vacation research scholar was fundamental to my subsequent career." After his early medical training at the Royal Adelaide Hospital, Professor McNeill subsequently moved to Melbourne, where he completed a PhD in clinical pharmacology from the University of Melbourne and completed his specialist training as a physician. Recognizing the important connection between clinical pharmacology and epidemiology, Professor McNeill was then awarded a National Heart Foundation Overseas Fellowship to study epidemiology at the prestigious London School of Hygiene and Tropical Medicine. He earned his Master of Science with distinction from the University of London in 1980. In 1986, Professor McNeill became head of the Monash University Department of Epidemiology and Preventative Medicine, subsequently becoming the School of Public Health and Preventative Medicine at the Alfred Medical Research Precinct, a position he held until 2019. Under his leadership, his department grew to over 1,000 staff and postgraduate students and developed a national leadership role in a range of clinical and public health research areas, including community-based trials, clinical quality registries, occupational and environmental health and emergency care research. He modestly says the goal of his career was to produce reliable medical information that can be used to improve public health. That goal saw his work appear in more than 700 publications with over 35,000 citations. He's also secured more than $150 million in competitive funding, including more than $40 million from the US National Institute of Health. As part of this work, Professor McNeil initiated and co-led the Australian-US ASPRI trial of low-dose aspirin in the elderly, one of the largest prevention trials conducted internationally. It involved 16,700 Australians aged over 70 and 2,400 from the US. Colleagues from the University of Adelaide made a valuable contribution throughout the study. This trial found that daily treatment with low-dose aspirin, which was then commonly recommended to millions of elderly people worldwide, provided no benefit to those without pre-existing heart disease or stroke. Within a year, the results led to changes in treatment guidelines throughout the US, Europe, and most other countries. At the time, Professor McNeil noted, it's not often that one gets an opportunity to be able to answer a question which impacts so many millions of people. During his career, Professor McNeil has fostered a new generation of public health researchers, with 18 of his 36 PhD students attaining full professorships to date. He shared his skills in a broad range of other leadership roles, including multiple directorships of organisations such as Alfred Health, Austin Health, the Metropolitan Ambulance Service, and the Victorian Managed Insurance Agency and Water Quality Research Australia. He also chaired the Victorian Public Health Research and Education Foundation from 2006 until 2008, served on ministerial committees advising on a range of health issues, and spent 10 years as Secretary of the International Society of Cardiovascular Pharmacotherapy. He received the Sir John Monash Distinguished Professorship in 2014, and in 2019 was appointed an Officer of the Order of Australia for his distinguished service to medicine in the fields of clinical epidemiology and cardiovascular research and to public health. Chancellor, I am pleased to present to you Professor John James McNeil, Bachelor of Medicine, Bachelor of Surgery, University of Adelaide, Master of Science with Distinction, University of London, Doctor of Philosophy, Clinical Pharmacology, University of Melbourne, Officer of the Order of Australia for admission to the Honorary degree of Doctor of the University, Honoris Causa.
We're very fortunate that Professor John McNeil has agreed to be today's graduation orator. Please make him welcome.
Catherine Branson, Chancellor, Professor Peter Hoy, Vice-Chancellor and President, distinguished guests, University of Adelaide academic staff, and all the students and staff here today, especially new graduates. To begin with, I'd like to acknowledge the traditional custodians of this land in which we're meeting, and pay my respects to their elders, past and present. Firstly, to the new graduating classes, congratulations to you and your families and supporters, and for your progress through your undergraduate years. Many of your studies will be been affected by COVID, and it's a great tribute to your resilience and your supporters that you've successfully navigated through this time. I would also like to mention how grateful I am to have received this award. It's especially important to me because of the way my own career was shaped by the teachers and researchers at the University of Adelaide who led me to develop an interest in clinical and public health research during my time as an undergraduate. I would like to make particular mention of two of my mentors, Professor Ivan Delaland and Professor Derek Fruin from the Department of Physiology and Pharmacology, who were remarkable teachers and had a big influence on my career. As the Vice-Chancellor mentioned, I was a Heart Foundation vacation scholar over many of my summer breaks. I worked under the guidance of my tutors to study blood vessels and platelets. And later in my career, these interests came together through research involving aspirin, which, as most of you all know, prevents blood platelets causing clots and blocking small arteries. So what are some of the suggestions that a person like me at the end of their career can provide for new graduates in the health sciences? I was tempted to repeat advice that I heard recently to suggest that you say yes to everything you're invited under 40 and no to everything you're suggested to you over 40. But I am no doubt going to repeat things that you've heard many times already from your teachers. After my 50 years or so experience in the health field, I have been in a unique position to see the rapid rate at which healthcare has been evolving and understanding its influence on our society. When I graduated in 1971, 50% of men had died before reaching the age of 70. This was predominantly due to heart attacks and stroke. But now, over 85% of men and nearly 90% of women survive into their 70s, 80s and 90s. As a result, we're now facing an increasing number of older people, which is creating a healthcare burden and creating a need for your skills. An imperative for healthcare is to maintain the health and independence of older people for as long as possible. And many of you will be contributing to this goal over future years. My second comment concerns the increasing importance of communication skills. As graduates, you know that scientific research underpins evidence base of modern healthcare. However, our society also accesses much other information from the internet and social media, some of which is well-founded, but much is unfounded, and sometimes it's dangerously ignorant. As health professionals, there will be an increased need for you to both acquire the accurate health information and to communicate it well to patients and the community who you'll be serving. But countering information is not easy, and communication skills are not a talent that everyone has. You are well qualified to take on this challenge, but it will require attention and improvement throughout your professional lifetimes. Now, a couple of comments to those of you who are entering a clinical career. You will have an amazing option, an exceptionally large range of career choices, well beyond what was available in my generation. There are now about 5,000 different disease entities and over 10,000 options for intervention. But although much is new, the fundamentals will remain the same as they've always been. This includes the recognition that most people are anxious and often fearful when visiting health professionals, and your goal will be to reassure them whenever possible, but always to demonstrate that you have their full interest in heart and will do your best to guide them through the health system. And for those of you beginning a career in public health and health services research, please keep in mind that the spectacular improvements in life expectancy and quality of life that have occurred over the last 50 years are fragile. They can be reversed, as appears to be happening in the US as a result of the opioid epidemic, and may be worsened by vaccination avoidance. So in summary, congratulations on your achievements, and I wish you all a very satisfying and productive career. You're graduating as health professionals at an exciting time in the evolution of healthcare, and I'm sure you'll make the University of Adelaide very proud of your contributions. Thank you.
behalf of the graduates and their families attending today's ceremony, I would like to thank Professor John Manal for his stimulating and inspiring address. We are honored that you have taken the time to join us on this special day to share with us your thoughts and experience. Your words of encouragement and advice are greatly appreciated. They remind us that graduation places upon each of us an enduring responsibility to make the best possible use of our talents and to contribute to the betterment of society in whatever way we can. Please join me in once again thanking Professor John Manal.
Left hand.
Chancellor, I, Professor Peter Hoy AC, Vice-Chancellor and President of the University of Adelaide, certify to you and the whole university that the graduates who will be presented to you have all fulfilled the conditions prescribed for admission to the award for which they are so presented.
Chancellor, I, Head of the School of Allied Health Science and Practice, Associate Professor Stacey Attrell, present to you graduates from the School of Allied Health Science and
Like this.
to the honours degree of Bachelor of Speech Pathology, Nazeeba Abdallah. Lauren Joan Boyan. Cindy Tan Chung. Sarah Louise Edwards. Brianna Jane Gibbs. Alice Grace Healy. Emily Imogen Jose. Esther Lange. Ara Elizabeth Lewis. Ella Liddy. Moan Theodora Mesopapis. Cassandra Norton. Rosalinda Grace Perry. Arismia Zakolis. Emily May Videra. Georgia Kate Wegner. And Elise Kate Wesley. To the honours degree of Bachelor of Physiotherapy, Sophie Jessica Adams. Jasjot Kaur Baithal. Millie Bird. Aileen Chen. Angel Chu. Jack David Cram. Alexander James Davies. Christine Victoria Drew. Ellen MacDonald Falconer. William Forster. Danny Go. Ruth Marie Hall. Tiara Louise Hatchard. Eloise Nicole Holland. Anvi Kachil. Riley Jacob Nevitt. Nicole Nikki Lee. Daniel John Malatesta. Stephen Mick Matters. Zali Bella Newton. Lauren Tweely N. Newen. Jackson Daniel Nutt. Macy Ann Porter. Meenakshi Pramod Nair. Lucy Jade Pryor. Advi Ramesh. Samuel Rayner. Tivani Sivasuthan. Hayley Rose Skinner. Caitlin Jane Stafford. Won Jin Ten. Hale Marco Thornley Thomas. Michelle Ann Tran. Dylan Truong. T. Tui An Vu. And Millicent Rose Wilkham. To the honours degree of Bachelor of Occupational Therapy, Yana Grace Badram. Tessa Bozo. Gabriella Marie Charlotte Byrne. Nicole Christie. Tumi Joshua Alimo. Ella May Florati. Sarah Fleming. Matthew Robert Gordon. Holly Rose Harris. Georgia Kate Ireland. Jobana Johnson. Ruby Northway. Edgar Timothy Amondi. Rihanna Rose Papanyi. Alyssa Catherine Pawolski. Andrew Pham. Georgia Ella Potter. Henry Alfred Reed. Jessica Everlily Russell. Rihanna Verrill. Sophie Louise Grace Wilch. And Imogen Wilson Shaw. Chancellor, this concludes the graduates from the School of Allied Health Science and Practice.
Chancellor, I, Head of the School of Public Health, Professor Tracy Merlin, present to you graduates from the School of Public Health. To the Graduate Certificate in Biostatistics, Rachel Hillier. To the Graduate Diploma in Public Health, Cassandra Jane Cromie. The Graduate Diploma in Counselling and Psychotherapy, Emery Alexander Krismali. And also receiving the degree of Graduate Certificate in Counselling and Psychotherapy, Carrington Maradona Vuyo Loco. To the degree of Master of Public Health, Siddhi Kamlesh Kumar Acharya. Himanshi Agarwal. Yung Tung Yan Ao. Abigail Molly Day Sharman. Madusha Dasanayaka Karupu Arachalaj. Yin Shan Le. Mariana Malay. Samantha Jane Williams McCardle. Ellie Jane Mooney. And Saili Vivek Panchwa. To the degree of Master of Counselling and Psychotherapy, Jack Ethan Castine Price. William Matthew Christopherson. Sarah Jane Corbett. Alan Joseph Curry. Carly Marissa Davies. Elise D. Pizzol. S. Rose Fowler. Ji Han Huang. Justin Liu Yu Ping. Adeline Yi Chin Kong. Yada Lay Balahadia. Rupert Alexander Lyle Dillo. Christopher Jack Marinos. Ellen Margaret MacDonald. Louise Margaret McNeil. Drishna Suni Merchandani. Nicole Montgomery. Asugi Munasami. Sarah Yogesh Natu. Abigail Natalia Nerona. Rebecca Joby Charayath. Jack Connor Reish. And Beverly Gwen Whitehead. The degree of Master of Clinical Science for a thesis entitled Compliance and Toxicity of Total Neoadjuvant Therapy in Locally Advanced Rectal Cancer, a Systematic Review and Network Meta-Analysis, Siao Chirangi Warren. The degree of Master of Philosophy, Medical Science for a thesis entitled Effectiveness of Erector Spinae Plane Block for Traumatic Rib Fracture Analgesia, Philip James Harford. The degree of Master of Philosophy, Clinical Science for a thesis entitled Effects of Combined Intragastric Administration of Quinine with L-isoleucine or L-leucine on gastric emptying of and insulin and blood glucose in response to a mixed nutrient drink, Mariam Sajjad. The degree of Doctor of Philosophy for a thesis entitled Infectious Diseases Attributable to Non-Optimal Temperature in Australia, Current Burden and Future Projections in a Changing Climate, Dr. Johannes Tefra Damtu. Now present to you the graduates from the Adelaide Medical School. To the degrees of Bachelor of Medicine and Bachelor of Surgery, Novindu Pubasara Navaratne. To the degree of Master of Minimally Invasive Surgery, Jimmy Lamb. To the degree of Doctor of Philosophy for a thesis entitled Risk Factor Modification and Left Atrial Remodelling in Patients with Embolic Stroke, Dr. John Leonard Fitzgerald. For a thesis entitled The Effect of Cumulative Trauma on Female First Responders, Dr. Helen Mary Fraser. For a thesis entitled Patterns of Psychotropic Drug Prescribing to Children and Adolescents Attending Australian General Practices from 2011 to 2018, Dr. Julie Marie Clow. For a thesis entitled Recovery and Outcomes After General Surgery, Dr. Joshua George Cavor. For a thesis entitled Clinical Insights into the NOCA Syndromes, Dr. Serena Soying La. For a thesis entitled Bridging the Gap Between Parkinson's Disease and Traumatic Brain Injury, the Role of Biological Assessments for Early Detection of Neurodegenerative Disease Risk and Prognosis of Clinical Outcomes, Dr. Angus McNamara. For a thesis entitled The Role of a Molecular Weight of Hyaluronan in Ovarian Cancer Stem Cell Signalling Pathways and Chemoresistance, Dr. Zoe Kathleen Price. For a thesis entitled Glycemic Consequences of Non-Nutritive Sweeteners in Human Health and Type 2 Diabetes, Dr. Braden David Rose. For a thesis entitled Improving Suicide Risk Prediction in Contemporary Serving and Ex-Serving Australian Defence Force Personnel, Identifying Risk Factors for Progression or Chronicity in Suicidal Thoughts and Behaviours, Dr. Nicole Sadler. For a thesis entitled Studies of Depression and Frailty in Older People Receiving Institutional Care, Dr. Tomomichi Sakai. For a thesis entitled Characterising Postural Orthostatic Tachycardia Syndrome and its Association with Post-Acute Sequelae of COVID-19, Dr. Marie-Claire Seeley. For a thesis entitled Anatomical Characteristics and Functional Significance of the Pyramidalis Muscle, Dr. Craig Leslie Short. For a thesis entitled Functional Outcomes of Suprapatellar versus Infrapatellar Approaches for Intramedullary Nailing of Tibial Shaft Fractures, Dr. Simon Felix Thwaites. For a thesis entitled Nutrition Challenges from the Intensive Care Unit to the Hospital Ward, Dr. Elizabeth Viner Smith. For a thesis entitled Development of Novel Ovarian Cancer Treatment Using CAR T Cells Targeting LGR5, Dr. Wanshi Wang. For a thesis entitled Environmental Exposures and Infertility, What's the Deal, Baby? Studies on the Reproductive Health of Australian Defence Force Veterans of the 2001 to 2009 Middle East conflicts, Dr. Rachel Warner. And for a thesis entitled Characterising the Microbiome and its Diagnostic and Prognostic Value in Head and Neck Cancer, Dr. Kenny Curley-Year. I now present to you graduates from the School of Biomedicine. To the degree of Doctor of Philosophy, for a thesis entitled Characterising Changes to the Blood-Brain Barrier in Healthy Ageing and Following Stroke in an Aged Preclinical Model, Dr. Isabella Megan Bilecki. For a thesis entitled Exploring Microglial Ageing, Insights from Human Genomic Data, Preclinical Animal Models and the Future of In Vitro Modelling, Dr. Laura May Carr. For a thesis entitled Development of CRISPR Therapies Targeting DMD Exon 51 for Duchenne Muscular Dystrophy, Dr. Yuchin Joshua Che. For a thesis entitled Prediction of Cognitive and Mood Trajectories and Clinical Awareness of Neurodegenerative Disease Risk Following Traumatic Brain Injury, Dr. Benjamin Paul Elul. For a thesis entitled Development of Strategies for Invasive Rodent Population Control through Modification of Naturally Occurring Meiotic Drive Systems, Dr. Luke Giras. For a thesis entitled A Multifaceted Approach to Explore the Role of Neuroinflammation in Chemotherapy-Induced Cognitive Impairment from Systematic Review to In Vitro and In Vivo Modelling, Dr. Olivia Jane Haller. For a thesis entitled Developing Novel Conservative Treatments for Endometrial Cancer by Targeting Aquaporin-1, Dr. Sidra Nawaz Khan. For a thesis entitled Characterization of a Novel Preclinical Model of Diffuse Axonal Injury, Dr. Justin Lee Krieg. For a thesis entitled Modulating Cortical Plasticity and Connectivity to Improve Motor Learning in Older Adults, Dr. Wei Merrick Liao. For a thesis entitled Investigating the Effect of Mesenchymal Stem Cells and Conditioned Media for the Treatment of Pain and Neuropathic Pain, Dr. Chrysostomus Constantine Maudis. For a thesis entitled Periconception Contributions to the Origins of Autoimmunity, Dr. Stacey Jasmine Savan. For a thesis entitled Adaptation in Dragonfly Target Detecting Neurons, Dr. Matthew Benjamin Schwartz. For a thesis entitled Deregulation of DNA hydroxymethylases TET1 and TET2 Compromises Skeletal Integrity During Aging, Dr. Nicholas John Smith. And for a thesis entitled Non-Invasive Brain Stimulation in the Treatment of Post-Stroke Aphasia, Challenges and Opportunities for Translation, Dr. Ellen Evelyn Robeson-Williams. Chancellor, this concludes the graduates from the School of Public Health, the Adelaide Medical School and the School of Biomedicine.
Councillor, I, Head of the School of Psychology, Professor Peter Strellan, present to you graduates from the School of Psychology. The Graduate Diploma in Psychology Advanced, Georgia Akiki. Onya Shapresa Allier. Sival Agun. Anesu Bepetti. Kyla Rhiannon Borg. Rebecca Joy Davis. Kim Deans. Obani Jesu David Doherty. Eflin Wright Elias. Elena Fonseca Lima. Georgia Gaylard. Lucian Alexander Graves. Gianni Dennis Gubert. Terry Ruth Hamilton. Abby Hawker. Irma Jasvin. Also receiving the Graduate Diploma in Psychology, Safrina Kelly Fuller. Gabor Laborts. Emily Job. Madison Jane Loader. Nailin Bayoran. Oscar Ocean. Paula Andrea Rojas Gayon. Mimi Seville Renata Jacobson Schroer. Tasma Charlie Schutz. Alia Brooke Smith. Angyun Sun. Tabitha Louise Vaness. Taylor Isabel Watson. . Thomas John Webby. Veronica Julia Wadachik. And Angelica Ida Zeni. To the Graduate Diploma in Psychology, Rachel Marilyn Brown. Jessica Kimberly Butterman. Sonia Yi Wing Chan. Tracy Lee Davey. Emma Raquel Francom. Rosanna Giampaolo. Sally Marie Hanson. Joanna Sue Hodson. David Lee Hood. Alana Brooke James. Kristen Kerr. Chloe Kirk. Brittany Ray Lippert. Ya Podel Banya Chitri. Genesee Mary Renshaw. And Brianna Worsfold. Councillor, this now concludes the presentation of graduates from the School of Psychology.
Chancellor, every year the university presents university medals to acknowledge the most outstanding graduates in each faculty who had completed a University of Adelaide bachelor's degree with honours or bachelor's degree of at least 4 years duration. The university medals are awarded to them for their consistent, outstanding performance across the whole of their undergraduate studies. I, Professor Peter Hoy, Vice-Chancellor and President of the University of Adelaide, present to you the recipients of the 2024 University Medal from the School of Allied Health Science and Practice. Lauren Joan Boyen. and Christine Victoria Drew. Chancellor, University Doctoral Research Medals are awarded to graduates who have completed outstanding research at doctoral level. This award is the premier award for doctoral candidates at the university. I, Professor Peter Hoy, Vice-Chancellor and President of the University of Adelaide, present to you the recipients of the 2024 University Doctoral Research Medal. For research in the field of public health, Dr. Jinming Liu. And for research in the field of medicine, Dr. Ryan Jalla.
I'm now delighted to introduce to you Samantha McArdle, who this morning receives the Master of Public Health. Samantha will give the valedictory address on behalf of the cohorts of graduates who received their awards this morning.
I'd like to acknowledge that we're meeting on Kaurna land today, and it seems especially fitting to acknowledge Aboriginal culture as one that has such incredible foundations in teaching, listening and learning. Chancellor, Vice-Chancellor, distinguished guests, fellow graduates and everyone who can be here today to celebrate this significant milestone. It's my absolute pleasure to be here and give heartfelt congratulations to each and every graduate. I'm humbled to have the opportunity to speak here today. It was quite a surprise to me to be invited to be valedictorian today. When I saw the invitation, I was both daunted and honoured, and quickly shared the news with my children, who were in the room with me at the time. I explained to my 5 and 7-year-olds that not only was Mum's homework finished, but I will also be lucky enough to speak on stage at my graduation ceremony. My very studious 7-year-old wasted no time in offering to write a speech for me. This is a tall order at 7, but she's very insightful and often has sage advice. So if you indulge me, I'll share some of her words with you now. Something is hard, keep trying and don't give up. My first time at uni, I was scared, but I didn't give up. And look at me now, I'm not scared to try new things. I've enjoyed my time here working with my friends, but my favourite part was to keep trying. Some things can be tricky, but don't give up. And if you can't do it, just go and have a cup of tea and come back and try again later. Thank you, Lucy, who has apparently seen me drink many cups of tea as I've scrambled to finish assignments. I began studying at the University of Adelaide some 20 years ago, a few short weeks after my 18th birthday. It's now a blur, but somehow I fumbled through to complete a double degree in health sciences and social sciences. I followed on to complete an honours degree and felt incredibly lucky to then have 5 or 6 years tutoring first-year public health students, alongside other paid work. As a teenager, I had either wanted to be a teacher or a psychologist. So to have the opportunity to teach public health to adult learners was a dream, and it exceeded all expectations. I was fortunate to begin a public health career working at the Cancer Council, right off the back of my final undergraduate year placement, which they supported. I moved to the health department and led the HIV public policy portfolio before diving into other equity portfolios. I had a career break to have children, and on returning to paid work, also decided to pursue a master's degree in public health. Today, I want to share 5 things that I've learned as a student here at the university at various points in time over the last 20 years. Learning number 1, you don't need to know where you're going to make a start. When I first started at 18, despite my enrolment, I actually had no idea what health sciences meant. I didn't know what public health was, and truth be told, it was several years before I could even articulate it in a meaningful way to friends and family. I didn't feel the pressure to commit to a distinct career path at that early age as some people do. Rather, it seemed like a first step on an adventure, one that might be a linear path or might take me on twists and turns that I had never anticipated. The important thing was accepting that adventure and making a start. Learning 2, you can do anything but you can't do everything. Choose what matters to you and do it well. If I'm honest, this learning is still a work in progress. As a working mum and a student, I have certainly stretched myself thin at times. For significant chunks of time over the past few years, I have tried to do everything. And I'm not sure that I have done very much of it very well. But the premise rings true. The times when I've paused, thought about what really matters, and let everything else go without guilt have been incredibly grounding. Throughout my adult life, this skill in prioritising has often meant that I've focused more on family, friends, and particularly my children, and I will always be grateful for this. Number 3, be curious. This lesson is the foundation of my study path and it has also fostered my career, supported my marriage, and now guides my parenting. Be curious. Embracing a love of learning is more valuable than the learning itself. I was fortunate to grow up in a home where education was encouraged, supported and celebrated, both in a formal sense with schooling and university, but also informally, with the joy in reading books and doing puzzles together. I'm very grateful to my parents. Their love of learning has put me in good stead for a lifetime of curiosity. Learning number 4 is to embrace challenges. I don't know about you, but the moments in life where I've felt most accomplished and most proud are those where I've really pushed to get through something difficult. I feel certain that every person graduating today has worked through difficult challenges to be here completing their studies. As I reflect on mine and my peers' experiences, I think those who worked full-time through the night stacking supermarket shelves so that they could then study full-time during the day. I think of those in precarious housing situations, those boldly beginning a second or third career path later in life, people managing substantial health challenges while somehow maintaining a busy study schedule, and many of my peers here today who are bravely living overseas away from their family networks in total commitment to their studies. What a huge accomplishment to rise and thrive through life's challenges. Learning 5, keep trying. Persistence is such a gift, and none of us would be graduating today if we didn't have a healthy dose of persistence. That internal push to keep working, whether that be dedication to a thesis over a period of years, continuing to cycle through exam revision, or staying up till 3 a.m. meeting assignment deadlines, only to do it all the next night for another assignment or another exam. As I reflect, one of my first working roles was actually not a great fit for me. Within a few weeks, my boss and I both each quietly came to the realisation that I was probably a bit too inexperienced for the work that I was employed to do. And that learning curve for me was steeper than either of us had anticipated. I stayed, I volunteered to work weekends without pay, and as someone who is usually a high achiever, I had the most rapid learning journey I've ever had in my life. Over the coming months, I came to be quite proficient in that role, and when I did eventually move on, that boss acknowledged that I was one of the hardest working people he had ever known. That persistence is one of the most important skills I learned here through my studies. I'm sure every graduate here today has a similar story of pushing through the grit and the grind to just keep trying. And maybe a bonus lesson today. When those challenges arise, and they will, just have a cup of tea and come back to things a bit later. It's been a long time since teenage me wanted to be a teacher or a psychologist. A few months ago, I moved on to my next career adventure, working with the education department, looking at how the system can better support students to feel engaged with schooling and have a sense of safety, belonging and connection. It was a light bulb moment for me to realise that this role brings together the very elements that interested me in teaching and psychology, but with a public health lens that now runs in my blood. I'm indebted to the university for the lifelong skills I've learned in my time here. I'm committed to using these skills now to improve our schooling system, to better support the well-being of the next generation of learners. My parents, husband and children are here today. Mum, Dad, Peter, Lucy and little Holly. I'm so incredibly grateful to have you always cheering me on. Now I invite all graduates to stand. We would all like to take this opportunity to thank the university staff and our loved ones for their care and support of us. Thank you. To staff and our loved ones, all guests here today, please join me in congratulating all of the graduates on reaching this significant milestone.
Thank you, Samantha. It now gives me great pleasure to congratulate as a cohort all of the graduates here today. Be proud of what you've achieved, and as Samantha has reminded you, remember those who helped you along the way. I wish you every success in this exciting new stage of your life and your career. As graduates of the university, you are also its alumni and its ambassadors. Over the years since this university was established, now more than 150 years, its alumni have made enormous contributions all around the globe. Today you join this community of over 174,000 alumni located in more than 148 countries of the world. We have 21 global alumni networks, including 8 international networks. I hope that you'll give some thought to perhaps joining one of those networks and staying in contact with your university. I know we're doing a lot of standing and clapping, but I do now ask all of the graduates to remain seated, and I invite everybody else who comfortably can to stand for the last time to congratulate all of today's graduates. Would the audience please remain standing? And I invite the graduates now to stand for the academic recession. Once the academic recession has left the hall, we ask our guests to remain in their place, and the staff of the university will help them exit the hall as efficiently as possible. I now declare this congregation adjourned.